for PDS at PrepLadder. So we are going to discuss something very important, some strategy points, some related points for all of those who will be sitting for INI Super Speciality 2022. So already just want to listen from all of you, whether I'm visible and audible to each one of you, so I can start with the session. It will be a small session. I'll be talking about things, many of which you already know. I'll just be, discussing things. I'll be also taking up some questions from your side. So now that the live session is now visible, so officially I'll start the session again. Good evening, everyone. I'm Dr. Sandeep Sharma, your PrepLadder Super Specialty faculty for pediatrics. And I am here to talk about what should be the revision strategy, what should be the master plan for INI Super Specialty 2022. See, I'm a pediatrician, so I'd be talking in terms of pediatrics, but anybody else of other specialties who will be sitting for INISS, be it the medical branches or these surgical branches, the principles will remain the same, although I'll be talking, the topics which I'll be talking about will be related to pediatrics itself. So after I discuss over the next 10 or 12 minutes, then I will be going live, and I'll be taking up any questions if you have from your end, and we'll be discussing it threadbare. So let me begin with, first of all, I'm sharing my screen, and some of the points which I have compiled, I'm going to share it with you. So here is my screen. So as you can see, so this is the last 3 weeks master plan for INI Super Specialty 2022 that we are going to discuss here. Right, just a second, please. Okay, so a disclaimer, whatever I'm discussing here is based upon what I feel. There are many paths to reach the same destination. So it is not that whatever plan you are already following, you should change it and start doing only because I am telling you to do so. But many of the students in the last 2 or 3 weeks, they are in a dilemma, how I should be revising, what are the areas I should be focusing. First of all, number of revisions you do, it should be as many as possible, but at the same time, you have only about 18 to 20 days left. So it should also be realistic. So this plan I have made in mind, keeping in mind that many of you might not be able, many of you will be working, many of you may not be able to squeeze out time. So this is a time which I have made, a master plan which I have made. In case you find some elements of these to be useful to you, you can continue with the existing revision plan that you're following, and you can incorporate the things there. Right? It is just a suggestion from my side. There can be better plans than this. End of the day, it is all up to you how you're going to follow. So first of all, some key information regarding INISS that I want to share. The exam is due on 23rd of April 2022. This is something you already know. Regarding exam pattern, again, you already know, but just recapitulating, total number of questions are 80. Total time allowed will be 90 minutes. So 1.5 hour time will be given to you. Negative marking is similar to any exam conducted by AIIMS, which is -1/3. So you will be getting +1 for a correct answer and -1/3 for a negative marking. If there is a question you have not attempted, that will be left as it will neither have a positive mark nor a negative mark. And then the syllabus, they very cleverly, very clearly say that it is general part of the branch which you are appearing for along with the specialty part. So general plus specialty, they have not specified in the prospectus how much exactly is going to be the weightage. This general versus specialty, where your focus should be more, is a discussion point which is more suited for branches other than pediatrics. We find that in pediatrics, even if they say that it will be a general paper, there are specialty questions. In the past, we have seen, and in specialty, there will always be general. So it is always an overlapping paper which is found. In general, we find that if you compare with NEET super specialty, in exams like INISS, the focus on specialty is a bit more. The focus on the specific areas that you have appeared for, the super specialty, the subspecialty part, it is a bit more compared to the compared to the nutrition part, development milestone part, which you tend to follow in NEET SS. Now, the qualifying criteria for the first stage will be 50%. And if you want to appear for the AIIMS exam, then there will be a part 2 where you will have to appear for the departmental super specialty paper as well. Now, what past experience shows to us? The past experience very clearly shows that the standard of question asked is usually higher compared to NEET super specialty. So the number and the quality of questions is a bit better. NEET SS of late has been trying to catch up, but we find that the overall standard of questions is higher in INI SS. Second thing is specialties have a overall higher weightage than general pediatrics, including nutrition, although it is based upon the past patterns, and there is nothing in the prospectus which says that similar rule will always be followed. It may or may not hold every time. Third point are the clinical questions which are there. If you listen to the interviews, which I have also taken some of them, they are available on the YouTube channel of PrepLadder SS as well. All of the toppers very clearly say that the questions are not exotic; they are from routine practice. And if you have been a good, resident, you have seen patients, and you have been reading correlating with Nelson, you can easily solve most of these questions. Then occasional image-based question and graph or chart-based questions are also very frequently asked in INI SS. These type of questions are relatively less likely asked in NEET SS. Then indirect biostatistics-based questions are also asked. So all the major, the basic biostatistics that you need to understand, the terminologies which are there, which you follow for your thesis papers, for your various publications, similar things, you need to have some idea for this exam. Plus, about 8 to 10 questions are of very high difficulty level, requiring text other than Nelson. And AIMS protocols are a must, whether it is the AIMS neonatal protocol or it is the AIMS PICU protocols. Direct one lines are picked from these protocols in INI super specialty exam. So AIMS protocol, if you have been reading them, revise them again. If you have not read them before, at least the important areas, the areas which you already know based upon past experience, you must go through once at least before you sit for the exam. So AIMS protocols are a must here. Just a second, please. Now, the master plan which I was going to talk about. Whenever you have a battle plan, whenever you have to sit for a battle, it always makes sense to move systematically. This master plan is not the so-called master plan. See, if I don't say it is a master plan, many of you will not be willing to listen to me. It is a plan from my side. You can take out components of these, whatever you find suitable, and incorporate in your existing preparation. In case you want to make your own master plan based upon these principles, you can do that as well. So what is the master plan according to me? So first is step one is defining how much time you have and how you are going to revise. So defining the available time and planning revision is of critical importance in these areas. So the total time you have, as I am taking this live session, is about 18 days. I'm not counting today's day. I'm not counting the day of exam. So total time you have in your hand is about 18 days. So revision one, basically 2 revisions, quick revisions are needed in this. Revision 1 should take about 12 days and revision 2 should take about 5 days. Now, many of you will think, sir, kaise hoga? People do it. And those who do it, they benefit from it. It's as simple as possible as thing. Same time is available for everyone. Nobody's having a time machine. Nobody's going to pause the machine. So pause time. So you have to make do with whatever is available. The game is very simple. It is 18 days. If you can squeeze into revisions, you can do excellent in the paper. Now the question arises, obviously, how you are going to do it. So step 2 is defining the resources. You have to fight a battle. First, you analyze your enemy. What is the battlefield on which I'm going to fight and what is the duration of the battle? Then you pick your weapons. What is your primary weapon? The primary weapon here is Nelson 21st edition and the AIMS protocols, the neonatal protocol as well as PICU protocols. These will be your defining resources which you have to use. Other than that, you can consider PrepLadder super specialty videos which I have recorded, which other faculties have recorded. Selected parts of these you can take up. Recent updates are extremely important. What recent updates you must go through? I have prepared a list of that. I will be sharing in the end. PALS protocol, NALS protocol, the latest NALS protocol are extremely important. So these are the basic resources, your weapons, which you're going to use for revision over the next 18 days. Now, step 3 is what to do in the first revision, the 12-day revision that you're going to do. About 5 days should be given to the so-called hardcore general pediatrics, which includes growth and development, nutrition, pulmonology, critical care, infections, and related topics, right? It will also include the genetics, trisomies, and the related syndromes. About 5 days will be given to the super or subspecialties. So you don't have much time. So what it will basically mean is 1 day you will devote to gastro and hepatology. One day will be given to cardiology. One day it will be given to pediatric neurology and neuromuscular disorders. One for critical care and endocrinology, and so on. This is the way you are going to divide it. This is the time which is left with you. Inborn errors of metabolism is important, but try to revise in about a day or so in the initial part of the general pediatrics part itself. Then about 2 days. We had 12 days, right? So about 2 days, recent updates will be needed and specific AIMS protocols you have to. You can mix and match. You can pick up one part from general pediatrics, one from super specialty also. It is something that you have to decide. You are mature enough, you are smart enough to understand. I'm just giving you a hint about how you are going to go about. Then step 4 is going to be the second revision. Second revision is something which you have to decide. Only 5 days are there. So you will only look at important topics, important things which you want to revise, which you feel inadequate at, and which you want to go through again. So customize as per your strengths and weaknesses. Now, step 5, there are some points of caution that I like to share with you. First thing is 80 to 85% time should be reserved for theory, 10 to 15% time for MCQs. Because the exam is very near, too much of MCQs is not going to help. So majorly your focus should be on theory. Although if you read only theory for next 18-20 days, the mind will get saturated. In certain areas, it will always make sense to solve some related MCQs. Like for example, you have read about the IMCI protocol. Try to solve MCQs related to this. You have gone through a case scenario, infections you have read. Try to go through the related case scenarios in MCQs for MCQ practice, just to open up your mind a bit. Second point is, do not try to read cover to cover. You can't read everything. You can't read entire things. Even your notes, if you have made alongside while preparation, you can't read them throughout. So be selective in whatever you're going to prepare. Third thing, if you are reading from Nelson, avoid reading pathophysiology details in the last 3 weeks. So time to read pathophysiology is long gone. Only focus on keywords in pathophysiology if you have to read. Then avoid reading new text in the last 3 weeks, except recent updates. So new text, it makes no sense for you to now open every textbook of neonatology. It's not going to help you. Revision of major, often asked areas is more important than reading untouched, exotic topics. Please understand that. This is a common message given by most of the toppers over the last year or so, including those who have cracked I&I super specialty. Have a look at the basic pressure volume waveforms. You have the pressure mode of ventilation, you have volume control mode of ventilation, how the normal graphs look like, what are the components of a graph, and how the graph changes in common pathological conditions like pleural effusion, ARDS, and capnography curve normal kaisa dikhta hai, and how when you suspect a blocked tube. These basic 8-10 graphs, if you can find, they're easily available in all the standard books. Even AIMS protocol talks about it. They are there in Nelson. They are there in all of the major texts that you are reading. Just go through them once, focusing on the basics. So if a image-based question or a waveform-based question is asked, you should be in a position to take calculated risk. And trust me, the graphs which are asked in the exam, they are relatively easy, provided you know what is the meaning, what is the interpretation of that graph, right? And do not overthink and overread in the last 3 weeks. Moderation is the key. 10 hours of consistent study per day for the next 3 weeks. I think that is going to be enough, focusing on the areas, the topics which I just told you and I'll be talking about. Then step 6 is last week areas and updates, where you should be focusing on. Now, when I say updates, people start thinking, sir, what are the updates that I should be going through? There is no hard and fast rule. We don't know what AIMS examiners have in their mind, but there are certain updates which have recently been released over the last 1.5 years, and they are extremely important. So I'm going to share a list. These updates you have to go through at least once or twice before you sit for the exam. Anything more than this, you're most welcome. So recent updates, these will be important for your departmental assessment also. So first is the ISPN, Indian Society of Pediatric Nephrology guidelines on nephrotic syndrome. There are 2 sets of guidelines. There is steroid sensitive and steroid resistant nephrotic syndrome. I have also prepared summary of video of this, which is there on the Prep app as well. Then AOCN guidelines related to febrile seizures and AOCN guidelines related to West syndrome, terminology, treatment part, etc. Then IAP 2022 guidelines on global developmental delay. There have been IAP guidelines on vitamin D deficiency and rickets also. They released in 2021, but they came out in 2022. They are easily available on the Indian Pediatrics website. You can easily download and read it. Then childhood COVID-19 management. One is the management part. Second is the perinatal neonatal update, again, which has been recently updated. This is the one update in which they are talking about pregnant females in the last trimester and what is the neonatal management to be done in suspected cases. This is something which is latest and you must go through. And unless you have read it, you may make mistake in the actual exam. Childhood COVID-19 vaccination is extremely important. There have been update on this. Recent updates 2 months back it came out. Then ISFGAN guidelines. ISFGAN is your Indian Society of Pediatric Gastroenterology, Hematology, and Hepatology and Nutrition. They have given guidelines on GERD management, and along with that, ISFGAN guidelines on celiac disease are also extremely important. Then pediatric non-invasive ventilation flowchart update is extremely important. Non-invasive flowchart update. Sorry. There have been a recent update on this. One of the co-authors is one of my seniors, Dr. Krishna Mohan. He used to be my senior JR. Currently, he is the NAMES, along with the two icons in the field, Dr. Kabra and Dr. Lodha. He has written a very beautiful update on that. And that update, he has given a flow chart. If you can't read the entire update, at least go through the flow chart properly. And that is a very, very important thing. It is a summary of the flow charts and the way that we approach non-invasive ventilation in children. So please go through it and try to be thorough with the at least the flowchart part if you cannot read the entire article. And then IEP and TEP update on pediatric TB guidelines. What are the categories? Diagnostic algorithm as well as the treatment algorithm, rifampicin sensitive TB and rifampicin resistant and the other drug resistant forms of TB. And then obviously the GINA guidelines on pediatric asthma. Step 7, be thorough with Nelson. What are the areas in Nelson you should always focus on before you sit in the exam in the last 3 weeks? This is, it's like a checklist I'm giving it to you. I'm not saying ki isme se aayega. What I'm saying is, if you sit in the exam, make sure that you tick ki haan, last 3 weeks I have gone through these and I'm pretty confident about it. First are the development milestone tables. Second are the cystic fibrosis chapter in Nelson that particularly focus on what particular feature is appearing at what particular age. That kind of chart is also there in Nelson. Please go through it. Then foreign body aspiration guidelines need to be read. Hepatobiliary syndromes is one of the favorites of INISS as well as NEET SS exam. So Ehlers-Danlos syndrome, inherited bilirubinopathies, conjugated, unconjugated, both like your Crigler-Najjar, Rotor, coproporphyrin level excretion between the two, and so on. I hope you understand the topics I'm talking about. All these inherited bilirubinopathies, Gilbert syndrome, etc. you need to read. Wilson disease is another area you should focus on. Then viral hepatitis, almost every alternate paper, there is a direct or indirect question. Then molecular therapies ranging from either gene therapies or adenoviral vector associated therapies to the new drugs used in CNS like eteplirsen, etc. Antisense oligonucleotide therapies, you have to read about it. The new drugs in cystic fibrosis, extremely important, you have to read. Then named surgical procedures in congenital heart diseases. All these entrance exams have a tendency to ask a particular details or the they will put you at named procedure. And they will ask you, they will say, Gore-Tex graft is useful in all of the following surgical management of congenital heart diseases except, or they will ask something related to it. So all these things you need to go through. Then primary immunodeficiencies are important and vasculitis is important. The last minute topics to be read from Nelson 21st edition, in addition to whatever you are reading. Then is your exam time strategy when you actually sit in the exam. So when you sit in the exam, keep an eye on the time. Don't overthink. Don't last minute ke liye don't keep too many questions. Take calculated risk. Attempt high. This is, nobody will know the entire paper when you sit in the exam. So you have to take calculated risk. And experience has shown that people who attempt high, they score better because the number of seats is very limited. So even if you cross 50%, that is still not going to be sufficient for you to get a rank, to get a seat of your choice. Now, when I say attempt high, I'm not saying how much should be attempted. It varies from person to person. It also varies from paper to paper. In a very difficult paper, obviously you can't attempt 80 out of 80. You will have to attempt somewhere around 70, 72 out of 80. But if it is an easy paper, your attempt should be around 75 or so. In no circumstance, your attempt should be less than 60 out of 80. Why? Unless you belong to that rare category. There is a rare category of students. They know that whatever I have marked is absolutely correct, and whatever I have not marked is something which most people will not be able to mark. If you belong to that category, then it is fine. You can mark 60, 62 also and get through with the paper. But majority of students, I know, they do make mistakes. There are inadvertent errors. We fail to read the common words in, all, except, etc., and it makes a difference. So please do not, go with preconceived notions. Attempt according to what you feel. Somewhere around 70, 75 in average INISS paper is a good attempt. Now, do not panic if the exam seems tough. The tougher the paper, the better is the chance of somebody who's well prepared to get selected. Then only 25 to 30% questions in INISS, you will know the answer without looking at the option, right? Please keep in mind. So 1/4 paper, 1/3 to 1/4 paper, only you will know they will be the so-called easy questions. Then another 25 to 30% questions, you can reach the answer by applying knowledge which you have. They will look intimidating, but if you rule out options, you will be able to reach the answer. And don't overthink. There is a syndrome called as overthinking syndrome, which sets into students when they say, intelligent students, yes, if a diagnosis is looking like pulmonary TB, think of pulmonary TB as the most likely diagnosis, right? Don't try to think of nail tuberculosis as the answer. Okay, it's a stupid example, but nail tuberculosis does not exist. So don't try to go in for exotic diagnosis. Go with practical application and you will still reach the answer. Another 25 to 30% questions will be like this. Take calculated risk in remaining questions, and about 10 to 15% questions, that is 8 to 10 questions, will be difficult or atypical or unheard syndrome, unheard biostat test, or a graph-based test which you have never seen, or a fact-based thing like asking the length of a particular organ, where you either know the answer or you don't know the answer. So these questions, you should be you should be very careful in taking risk in them, and only take risk in if it is a clinical question. See, if you have two questions where you want to take risk, one of them is a clinical question, one of them is a fact-based question, there is a good probability, since we all are clinicians, somewhere we might have applied some knowledge. We might not know about the diagnosis, but we may know something about the other options, and you can still rule out the other option. Even if out of 4 options you are able to rule out one option, your chance of getting the answer correct is 33%. On the other hand, if it is a fact-based thing, length of esophagus in a 2-year-old child, 10 centimeter, 12 centimeter, 15 centimeter, 20 centimeter, you have absolutely no idea. The chance of you getting a correct answer is only 25%, 1 out of 4. So which is a better risk-taking thing? The clinical question. So go with selective risk-taking in clinical question based upon how the paper is and how easy you are finding, how much your overall attempt is, right? So all these things, they sound very useful when you are preparing, but end of the day, it all comes down to individuals and how well you have prepared, how well you have understood Nelson, how well you have understood your subject. If you know your subject, even if you have read Nelson selectively, you can do wonders in the paper, because not everything in Nelson is important, and not everything in Nelson is likely to be asked in the exam. Understood? So I'll end with a quote which says, any plan is only as good as the warrior and his sword. His does not mean, I'm not talking about the males only, it applies to the girls also. But the message here is, it all comes down to individuals. You can make plans, but it will all depend upon how good of a warrior you are and what kind of resources you have utilized for fighting that war. So stick to AIIMS protocols, stick to Nelson, stick to your own notes which you have made, go through recent updates, do fast revisions, areas which are weak but are important, try to go through them multiple times. One quick revision in 10 to 12 days, another small revision only on important topics, difficult topics, easily forgettable topics in the last 5 or 6 days. That is all from my side. I hope some of the points will be useful for you. Whatever point you find useful, you can incorporate in your preparation. Now, in live chat, somebody has just mentioned, Sir, AIMS PICO protocol to be read even for neonatology exam. See, no, I'm taking a general approach. I'm not taking a specialty wise approach here, because many of you will be sitting for different specialties, different areas. Some of you will always also be sitting for the adult exams also, the adult cardiology part, because eligibility criteria is there in INSS, right? So what I'm talking about is, are the general thing. So if you are targeting critical care, or you are targeting, then obviously the AIMS PICU protocol is to be read for neonatology. AIMS neonatal protocol will be more important. There are some overlaps which do happen, and you may find that some neonatal question is being asked even in a critical care paper also, because they may consider it as a part of general pediatrics as well. So this overlap does happen. It has been happening all through the past years. So be prepared for that. At least go through the AIMS protocols. Whatever specialty you are following, go through that. Like, for example, you are targeting pediatric endocrinology. So go through the diabetic ketoacidosis part of AIMS protocol, AIMS PICO protocol, right? Devdeep Mandal is asking, tubular disorder videos not uploaded. Devdeep, tubular disorder, there was an approach video I had specially recorded, and then there were tubular disorder recorded by the previous nephro faculty that should be there on the app. I'll talk to them. I'll discuss with them why it is not available. I'll just check and I'll make sure it is available in a day or so. So any other comment from your end? You're most welcome to ask about it. Akula Kapil is asking, look at pending videos and tubular disorders. Akula, tubular disorders has already been done. Congenital infections, vaccines, NRP, all these have been recorded by the existing faculties of the corresponding subject. I'll make sure that videos are available. I'll talk to them. Shrikant, approach video I recorded specially. I made it like I spent full 1 day on making the approach video. So I know the approach video has to be there. It was there some days back also. I'll just see why it is not there. Akula Kapil, also summary about antenatal hydronephrosis. Okay. Antenatal hydronephrosis, what we can also do is, obviously I'll put it up on the app as well, but I can also take a small session on that, just the summary part, so that you know these are the rare important things about antenatal HN that we need to know. Shrikant, edition 1 videos, I was told that they have been restored. If they have not been restored, I'll drop a message to them again. I'll do that. All these live chat messages may not be visible after this video goes on YouTube, so I'll just write them down. Okay, thank you very much for listening to me, for bearing with me. I hope the points I discussed will be beneficial for you all. So I'll come again live. You have any queries, you're most welcome to ask me again, and I can always address specific queries related to specific things if you have. Ronald is asking, for peds oncology, Nelson is enough or Lanzowski is to be revised? Ronald, if you're targeting pediatric oncology, Lanzowski selectively has to be done. Nelson alone is like, playing with fire. There are certain parts which are not adequately covered in Nelson, but yes, Nelson has to be done along with selected parts of Lanzowski. Lanzowski, you can't read cover to cover. So the important areas which are not adequately covered in Nelson, you need to read them. But if you haven't read before, do not start at this moment, except for some tables or selected areas. Whatever videos I've recorded in SS, I have made sure to incorporate Lanzowski wherever it is possible. So if you're revising through those videos, rest assured I've covered most of the important things. Okay, thank you very much. It was lovely speaking to you all and taking this session. I hope all of you do exceedingly well in the paper, and when the results come, I would love to take interviews with you. So be motivated, stay motivated. End of the day, don't get overstressed. All of you are pediatricians, and all of you are excellent people. So don't worry and do the best. All the best for your exams.